Hello, welcome to the first of two interviews on the impact of COVID-19 on human rights and gender equality. My name is Mafalda Infante. I'm Unite's head of parliamentary engagement, and the week began with the new World Health Assembly. So today we will be discussing human rights, more specifically how the pandemic impacted the rights of people who use drugs and people in prisons. In the next interview, you will hear about the impact on gender equality, women's rights, and also LGBTQIA plus rights. These two interviews are happening within Unite's participation in the World Health Organization campaign, advocating for a safer, healthier world, safe from pandemics. The goal of these interviews is to listen to first-hand experiences from civil society organizations and advocates, as well as current and former members of parliament. Today we have Giada Girelli from Harm Reduction International with us to discuss these issues. According to the WHO, the pandemic agreement aims to address the gaps and challenges witnessed during the pandemic and ensure that we are better prepared for future health emergencies. The work to negotiate a pandemic agreement is underpinned by the principles of equity, sovereignty of states parties in addressing public health matters, science and evidence, respect for human rights, solidarity, accountability, and responsibility as well. And it is exactly about these gaps, those that were faced during the COVID-19 pandemic, that we will talk about today, as we definitely don't want them to happen ever again. So first of all, welcome Giada, and thank you for joining us.
Thanks for having me. Good morning.
Thank you. So to start, could you briefly introduce yourself and, of course, the work of Harm Reduction International?
Sure. Thank you, Mafalda. So my name is Giada Girelli. I'm a senior analyst at Harm Reduction International, and I work in the HRI's Human Rights and Justice team. Harm Reduction International is a non-governmental organization which promotes harm reduction and drug policy reform through research and advocacy. Our aim is to show that rights-based, evidence-informed, health-centered responses to drugs contribute to healthier and safer societies, and that investing in harm reduction makes sense. In the context of COVID-19, because this is going to be the focus of our conversation, HRI focused a lot of our work on the impact of the pandemic, but also of governments' responses to the pandemic on the health and rights of people who use drugs, their communities, and other marginalized groups, such as people in prisons. And we also tried to look into the lessons that other health emergencies, particularly HIV and AIDS, could teach us on how to effectively address COVID-19 while safeguarding fundamental rights. It's a pleasure to be here today. So thanks again for having me.
And thank you. Thank you so much for joining us. So you were mentioning the work of HRI during the pandemic and in trying to understand what were the impacts on people who use drugs and other vulnerable populations. So can you give me exactly an overview on how the COVID-19 pandemic affected human rights, especially those of people who use drugs?
Sure. So as we also in our individual lives, we can say that the COVID-19 pandemic in itself had a massive impact on virtually every human right, starting, of course, from the right to health, but then reaching further into the right to liberty, to privacy, to education, just to name a few. While the impact of this health emergency on society in general was unprecedented, we really witnessed how groups in society which were already marginalized and underprivileged were actually disproportionately impacted by the virus, as it's often the case when it comes to crises and emergencies. With regards to the health and the right to health of people who use drugs specifically, we saw that harm reduction services really suffered significant setbacks during COVID, and this was due both to the pandemic, but also to restrictions that governments put in place to control the spread of the virus, which were very much necessary, but not always possibly proportionate. These included staff and equipment shortages, supply chain disruptions, including for drugs for opioid agonist therapy, the closure of essential services and centers, or their working on limited hours, and also an added layer of obstacles and reluctance by people who use drugs to access harm reduction services and other health services. And just to add on this point, precisely because of stigma, marginalization, and also administrative administrative barriers, people use drugs experience unique obstacles in accessing COVID-19 services, including later on during the pandemic vaccines. To this, we should also add that the pandemic as well as the lockdowns really impacted on the housing and work situation of already marginalized communities, which was already fragile in many cases. As a result, many members of this group found themselves with really no way to earn any income, while also being unable to access benefits or other form of supports, again, because of administrative or bureaucratic obstacles with a direct impact on their livelihoods in general. But what we quickly realized and what HR really focused on was the fact that during the pandemic, people's rights were affected not only by COVID, so not only by the virus, but also, and in some cases, mainly by states' responses to it and by how the health emergencies was handled by governments. Many states adopted exceptional measures, sometimes invoking emergency executive powers, often pivoting towards highly securitized responses, and so declaring those wars against the virus, which we heard talk about a lot in 2020 and 2021. The military became very often involved in the response, and failure to comply with COVID-19 control measures was in many cases criminalized, so that many people who couldn't or wouldn't comply with those regulations would end up arrested or detained in overcrowded facilities, which themselves became then hotspots for the virus to spread further. All of this for us raised a very stark parallel with the war on drugs. And in the same way as the war on drugs is ineffective in addressing drug use, but also drug-related health harms, this kind of approach was really ineffective to control the spread of COVID-19, and in fact was in many cases counterproductive. Our community partners around the world documented how lockdown measures had a particularly negative impact on vulnerable populations, including but not limited to people who use drugs, with these new policing powers frequently exposing those already visibly poor and discriminated against to greater health risks. So people who use drugs or people who were in fragile situations became even more exposed to law enforcement. And these COVID-19 regulations were in many cases really misused and became one more tool for law enforcement to target, to arrest, to search, and to imprison this population. Just one last thing to mention in the context of COVID, which really characterized the response to the pandemic, is that against this backdrop and against this situation of crisis, communities and harm reduction services really showed incredible creativity and innovation, and new and sort of never tried before ways were found to continue delivering harm reduction services and keeping people safe in this very sort of unsafe and unpredictable, unprecedented environment. These included, just to give some example, a shift to online services, but also increasing access to, for example, take-home doses or home deliveries. Also, harm reduction services not only found these new ways of delivering services, but also made sure that people had access to those things that became very much essential, even more essential in times of COVID. So started providing housing, food, and personal protective equipment, and later on in the pandemic, even vaccines. I'll stop here.
Yeah, no, thank you very much for sharing. And so, from all the issues that you've mentioned, from all the challenges, which are the most critical effects that we still face today, now that the pandemic is over?
So first of all, there is limited information available for us on really the long-term impacts of both COVID-19 and the responses to COVID-19 on people with drugs and on harm reduction services. What we do know from community organizations and people working on the ground is that some of these innovations that I was mentioning earlier were really maintained and institutionalized after the emergency. One example is that of online services, which were introduced in Australia and New Zealand during COVID, so to sort of overcome the barriers of the lockdowns. And these online services are still operational today. Another example is that of Belhaven, which is an integrated harm reduction service, which was created in Durban, South Africa, to deal with drug use and homelessness in the earliest stages of COVID-19. And this new service is still very much operational and very much successful today. However, it really remains to be fully determined to which extent these innovations were kept or rolled back and to what degree. And HRI is now doing research on the global state of harm reduction in 2024, so we hope to have a clearer picture on that soon. One area on which we do have a bit more of information, or we did a bit more research, is that of prisons. In 2023, HRI looked into prison management and sort of which COVID-19 related measures were kept in place or how they were amended after sort of the critical stage of the emergency. And what we found is that as of February, March 2023, lots of the exceptional measures which had been put in place to protect the health of people in prison remained in place well beyond what was needed or justifiable. So during COVID, prisons really went into lockdown and really experienced very significant limitations to contact with the outside world, for example. And these measures were to a degree proportionate and necessary, but what we saw was that during the pandemic, they sort of became institutionalized, and there was little criticism about whether these measures had to be kept in place or not. And so rather than improving the health and safety of people in prison, these preventive measures really ended up having negative impact on the provision of harm reduction services and of services in general in prisons, making detainees really more vulnerable to health and human rights. In terms of long-term effects of COVID, we also noted some trends in terms of harm reduction funding. And what we can say is that the pandemic has further delayed transitions from international to domestic funding for HIV, and this in turn has led to worsening poverty, the cost of programs and commodities. More generally, what we can say is that we really failed to learn, once again, the lessons of COVID-19 in relation to many essential issues. First of all, again, the use of punitive measures and punitive approaches to deal with public health emergencies, but also more specific issues such as, for example, community-led services. And this is, again, perhaps most visible in the context of harm reduction funding. So as I was saying before, something that really came up clearly during the COVID-19 lockdowns and the pandemic was that community-led services were essential. They stepped up, they were able, because of the way they are organized and because of where they are, to really shift and adapt to the emergency and to respond effectively to the emergency. And they were particularly effective when they were provided with flexible and enhanced funding. I have to say, during the pandemic, some donors, not all of them, really stepped up and provided community-led organizations with really flexible funding that allowed them to reorganize their operations. However, comes 2024, flexible funding earmarked for communities seems actually to be diminishing, even after all these sort of best practices that we saw during the pandemic, and many donors yet don't even record the data on funding for community-led organizations specifically, which makes our research and our advocacy really quite challenging. And this is just an example of COVID-19 being one more opportunity to learn very important lessons on how to address public health emergencies effectively, and us sort of failing to do so to a degree.
Definitely. And as I was mentioning before, the World Health Assembly just started, and we are trying to understand and to follow up on the work regarding the pandemic agreements. So how do you see this process moving forward? What are your concerns?
Sure. And again, it's very hard to talk now. We're speaking on Monday morning. The WHA has just started, and it's still very unclear how things will develop. But I say that HRI has been working on the pandemic treaty or pandemic accord really since its inception, and particularly in the earliest phases of negotiations, advocating for a strong focus on human rights and on marginalized communities, including people who use drugs and people in prison. These days, we're mostly following the work as part of the Civil Society Alliance for Human Rights in the Pandemic Treaty, which is this alliance of organizations and experts, civil society organizations and experts looking and advocating around strong human rights content in the Pandemic Treaty. So I want to acknowledge the Alliance for all this work. The issue is really a failure to put human rights at the center, which is dramatic if we consider the impacts that we just talked about in terms of human rights, but also the fact that human rights-centered responses were really more effective in keeping people safe and in controlling the spread of the virus. The Civil Society Alliance had very clear asks about this latest round of negotiations that ended last Friday 24th, which centered around these two topics I just mentioned. So first of all, we were asking for much stronger language on human rights, which were only mentioned twice in the draft text. In particular, the accord didn't include any language on promoting and fulfilling human rights as a guiding principle, as well as on proportionality and on permissible limitations or derogations from human rights in terms of public health emergencies. There are some international standards which are very clear on this issue, but which weren't really taken into considerations by government during COVID. So for us, a very strong acknowledgement of these principles and the integration in the court was essential. And secondly, we were advocating for any language, but definitely strong language on the meaningful participation of communities and on civil society in the Conference of Parties, which was this sort of representative body which would oversee implementation of the accord. And there's essentially no non-state actors engagement envisaged in this instrument. Now, this WHA, which just started today, had been identified as the cutoff date to adopt this instrument. And so expectations were really high, but it appears from updates from Friday afternoon and this morning that most likely there won't be a pandemic treaty at the end of this session, which is somewhat disappointing. And the reason is that at the end of the day and after intense negotiations, member states couldn't agree on key aspects of the text, particularly on issues such as benefit sharing, vulnerability, and intellectual property. So those issues where that principle of solidarity that you mentioned at the beginning should really have been implemented and have been sort of characterizing negotiations. And the issue here, at least for us, is that countries from the global north were at the end of the day, either unable or unwilling to acknowledge and address the severe disparities and inequalities in the global health system that the pandemic had laid bare. We don't really know what will happen now. We believe that the IMB Bureau will present the Assembly parts of the text that have been agreed on and the report of what has happened in the past week, and that the Assembly will discuss the way forward. So it's still possible that we will have a document. We don't know which kind of document, though, which form and content it will take. But I would say we're mostly concerned by this seeming lack of ability or willingness by the part of member states to really rise to the occasion and to put in place a new approach to pandemics which places human rights and public health at the center. Mm-hmm. We do know, and we keep hearing that a new pandemic will come at some point. We know that the instruments we have in place today at the international level are not up to task simply because they haven't worked the last time. And they're particularly effective at dealing with public health emergencies with an equitable sort of approach. So we absolutely need a new approach, which is centered around human rights, equity, but also accountability and oversight of governments. And it doesn't appear that member states are really able to achieve that at this point.
Mm-hmm. Yeah, thank you very much, Giada, for sharing your concerns. On our side, on the side of Unite, we've been also working or following closely the pandemic, the discussions, the negotiations around the pandemic agreement. And since the beginning, one of our main asks was also the inclusion of members of parliament in the negotiations and the discussions. We've developed last year, and it continues for this year for other forums, but a campaign called Join Your Delegation. The goal of that campaign was to indeed include members of parliament or advocate for the inclusions of members of parliament in the national delegations to the World Health Assembly as a way to on the one hand, make sure that parliamentarians are aware of the discussion so that they can be well informed and bring those discussions to their national parliaments. But at the same time, because members of parliament, if pandemic agreement is finalized at the international level, it will always go to the parliament to be ratified. And so members of parliament are those that will vote and will ratify or not a pandemic agreement. And at the same time, they will do all the follow-up of that ratification, such as the budget, within the budget discussions, approving, adapting certain laws, public policies that were already in place and that would need to be adapted following the recommendations, the international recommendations. And in the end, they are the representatives of the people. So they should, from our perspective, be definitely included. So I just also wanted to give this feedback. And we've been collaborating on with Harm Reduction International specifically on these issues as well, for the inclusion of civil society, but also the inclusion of members of parliament as direct representatives of their constituents. So again, thank you very much, Giada, for your contributions. As I mentioned in the beginning of the interview, today we really wanted to hear about your thoughts on the gaps and challenges that were witnessed during the pandemic, and ensure that we are better prepared for future health emergencies. So thank you for sharing that with us. In light of the impacts of the COVID-19 pandemic on societies worldwide, the importance of a pandemic accord cannot be overstated. Such an accord, an agreement, would serve as a comprehensive framework globally agreed upon to guide coordinated responses to future pandemics. The accords would address critical aspects highlighted by the COVID-19 crisis, including healthcare system resilience, economic stability, educational continuity, protection of democratic principles and human rights, as you mentioned, and the promotion of peace and social stability, also related to what we've been discussing here. Before we finish, I'd just also like to mention that Unite has been sharing on social media a series of questions and explanations about the pandemic accord and its negotiations, debunking myths and misinformation or disinformation around the pandemic agreements. So once again, thank you, Giada, for joining us, and thank you all for listening. And we hope to see you and to continue this discussion on our social media and on our next interview on gender issues. So thank you very much once again.
Thanks for having me.